Another option for weight loss surgery is the laparoscopic adjustable gastric band. The gastric band is a device. We're not going to remove or rearrange any part of you. We're going to put a silicone device in around the top of your stomach and put a small port underneath the skin on the abdominal wall. The port will be connected to the band, and the band will wrap around the top of the stomach. The band has a balloon secured to the inside of the rigid portion. So when we put fluid in the band, the balloon gets larger and the opening on the inside of the band gets smaller. When we remove fluid, the opposite is true. The fluid comes out of the balloon and the opening gets larger. This opening acts as a regulatory device for how quickly your food is going to move from your esophagus or your food tube into your stomach. The position of the band is very important. The band is placed on an area of the stomach called the cardia. The cardia is different than the rest of your stomach. There are multiple nerve endings at that location that monitor and send signals to your brain that you've eaten food. With a gastric band, we want the opening at that level to be just wide enough that when you eat a 4-ounce portion of solid food, it takes about 20 minutes for that food to move across the area. That's just enough time for those nerves to send a signal to your brain that you're full. Unlike gastric bypass or sleeve gastrectomy, there's no secondary hormonal component. The intestines are not rearranged and a portion of the stomach has not been removed. So people will get hungry during the day after they've had gastric band. Now, there are studies that show that level of hunger is decreased from before surgery, but it's not zero. So it's very important with the gastric band that you eat 3 times per day, evenly spaced throughout the day, breakfast, lunch, and dinner. The meals need to be solid foods, not soft foods like mashed potatoes or smoothies or ice creams, or even protein shakes, because those foods are not going to deliver the level of hunger control that you will need to effectively lose weight. When people are eating the correct foods in the right portions at the right times during the day, and their gastric band is adjusted properly, they tend to lose between 1.5 pounds and 2 pounds per week. That may seem like slow weight loss, but when you add that out to 6 months or a year, you're talking about 50 to 100 pounds of weight loss. On average, people with a gastric band are going to lose about 50% of their excess weight over 12 to 18 months. That's not as high as other operations, but it's still significant weight loss and likely to result in significant improvement of medical comorbidities like sleep apnea or hypertension. The gastric band has been documented to work best in patients with a body mass index under 42. In that group, the weight loss result is a bit higher, and that group is uniformly a bit more successful. And so we typically aim gastric banding in that group. In addition, as I've said, there's a significant behavioral component to the operation, right? You have to eat 3 times per day, certain foods that largely you need to prepare yourself. People with daytime jobs that work in offices are much more likely to be able to do that kind of work than, say, a nurse who works at night or a long-term truck driver that has odd hours. And so we typically will try to match the band therapy to the patient whose lifestyle is going to be compatible with it.